Good afternoon. We'll start our November the 5th briefing, and we want to give you some information. First, it appears the numbers are ticking back up, and that's a concern, so I hope you'll listen closely to Dr. Bird today on his presentation and his recommendations how we can kind of stem that increase. But we want to thank you for doing everything you can. Please continue to practice your protocols. I know when things get relaxed, we seem to relax and think we don't have to abide by them as much, but I think you'll see the numbers are showing that our relaxing is making the numbers go up. And so we don't want to have a big spike. We're getting into the holiday season and we want everybody to be healthy. And so you can have your families and things together for the holiday season. So please pay attention to what you're doing and how you're doing it and keep following the protocols. And we'll continue to keep you abreast of the developments and wish everyone a good holiday season as we head into November and December. So Annette Rodriguez will be coming and giving us some information from the health district, and then Dr. Bird will be providing some information that I think is really important to us, both as leadership and the community, so that we can work together and whip this thing. I hope it's gone by the end of the year. So I think we're all looking forward to 2021. 2020's not been fun. So let's work together here these last 2 months and try to hit the new year COVID-free, if not sooner. So let's work together on that. At this time, Annette Rodriguez will come from the health district to give some information, and then Dr. Bird will come and tell us what he sees and what he's predicting, and we want to listen closely to him. So, Annette.
Las cifras positivas van en aumento, pero el reporte del doctor Chris Bird le va a dar información importante. Le pido también que no baje la guardia y así se mantenga saludable junto con su familia. La directora del Distrito de Salud, Annette Rodríguez, le va a dar su reporte y el equipo de la universidad también va a dar su reporte en cuanto a la situación. Esperemos que esta situación en relación al COVID-19 termine junto con este año.
Hi, good afternoon. Annette Rodriguez, Public Health Director, and we're going to start out with the COVID-19 statistics. So the first slide you see up here is the donut shaped graph, and it basically shows you 3 sets of numbers. The first is the number of deaths, the 451. The next is the 20,611. That's the total number of COVID-19 individuals that have recovered here in Nueces County. And so the last are the active cases. If you take the total, the 21,583, and you subtract out those 2 numbers we just discussed, you'll be left with 521 active cases of COVID-19 in Nueces County. Next slide. So here you see hospitalization patient numbers are increasing. So they dipped down around October the 28th, the 29th, and the 30th. They were in the 50s. Now you see them going back up. The cases today are also going back up. Today we had 73 cases. Yesterday we were at 44 cases and 1 older case. And so the numbers are going back up, and we see that. And we see that in our patterns as well in the hospitalizations, and that's where we need to be especially careful. Next slide, please. This is actually the ICU patients, the COVID patients that have to have ICU assistance. These numbers are also going up. You can see on the 29th, the 30th, and the 31st of October, we had 17, 19, and 20 cases in the ICU, and now today, 26 cases. So these individuals need additional assistance at the hospital. Some need to be on the ventilator, and so these are very critical patients. Next slide, please. These are actually cumulative of the COVID-19 deaths in Nueces County, and we had one death today, and so our condolences go to the family and friends of that individual that passed away from COVID-19, and that brings our total up to 451 cumulative cases of people that have died from COVID-19 in Nueces County. Next slide. This actually shows you the fatalities for the last, since October the 23rd. It shows you day by day the number of deaths. If you look at October the 27th, 28th, 29th, and 30th, we had 0 deaths for those 4 days. And since then, we had 1, 0, 1, 0, 1, and 1 again today. Next slide, please. So the last slide I'm going to show you is going to be the bell curve that we look at from May the 21st to the present. And it basically shows the bar graphs, the blue bar graphs, the daily cases, and then you see the red line that goes through there. The red line is the 7-day average, and we've been giving you that 7-day average at all the press briefings. Today, our 7-day daily average is actually 41, so it's also increasing as our numbers increase. I'm going to turn hats for just a second, and I'm going to talk to you about the health district. So yesterday at the health district, we held a COVID-19 drive-through. We had 75 individuals that were tested, and 20 of those were positive, giving us a positivity rate of 26.6%. That is still very high. If you are experiencing COVID-19 symptoms, you can self-register for one of our drive-thrus at www.cctexas.com/coronavirus under recent updates, or you can call our hotline at 361-826-7200 to get help with registering. As the weather gets colder and COVID-19 continues to circulate, there is still time to get a flu shot. Both COVID-19 and the flu on their own can cause severe illness and even death. Together, they have the potential to be even more lethal and can cause negative, long-lasting effects. Don't keep putting it off. Get your flu shot today. To get a flu shot, you can call our number, the Health District, 361-826-7238, and get registered for one of our drive-through flu clinics. Regarding our reporting process, there is a new CDC definition in our case criteria that became effective November 1st. The new case definition is for a suspect case. So everybody knows we have confirmed cases, we have probable cases, now we also have suspect cases. A suspect case is a case that has a positive result from an antibody test and has never been a confirmed or a probable case. A suspect is also a positive antigen test post-mortem. So now we have 3 case definitions: confirmed, probable, and a suspect case. So what are we seeing at the health district? We are seeing our phone volumes increasing, requests for testing and participation in our drive-through is also increasing. The people calling are telling us that they were exposed at Halloween parties where they found out positive COVID-19 cases were at, and now they're also having symptoms. Our contact tracers are seeing more individuals that have recently traveled and are coming back to Nueces County and asking to be tested. We saw a whole family that traveled to El Paso for a wedding. All 6 came back positive for COVID-19. Schools are also seeing increased cases due to face-to-face instruction as well as athletic events. Students at the university levels are coming back to Nueces County to quarantine and or to isolate. With so many different situations, flu season, the winter months, we are getting into a very serious situation that we all need to be following very closely. The situation is worse now than it was in July. We do not have a vaccine, nor do we have medication that can make this virus disappear. The good news is we are hearing that vaccine may be available in early January. That means we need to assess the situation and make decisions based on the data. If you do not want to take any chances in getting this horrific virus, then you need to stay completely away from it. Stay home if possible. The further you are away from others, the less likely you are to get sick. If you must go out, think carefully about some things that are available to you like curbside, and or plan your outing to be quick in and quick out and back home to stay safe. Practice the 3 W's, wearing your mask when out, watching your distance from others, and always washing your hands frequently. Do not touch your eyes, nose, or mouth with unwashed hands for fear that you will infect yourself with the virus. As we start thinking about Thanksgiving and everything we are thankful for, we also need to be thinking about small family-only gatherings with those that live in our household, or inviting family members that are practicing behaviors that will not put any of our families in jeopardy. Be thoughtful of others and help our community to fight off COVID-19 together. Stay safe, stay united in this fight, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 36 casos confirmados por el coronavirus y 37 casos probables, haciendo un total de 73 casos. A la fecha, el total de casos suma 21.583. 20.611 pacientes se han recuperado por completo, 67 continúan en el hospital, 26 están en la unidad de cuidados intensivos, 521 son casos activos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 451 personas. Ayer el Distrito de Salud realizó la toma de especímenes. De 75 personas, 20 resultaron positivas. Si cuenta con síntomas, puede registrarse en www.cctexas.com/coronavirus o llamar al 826-7200. A medida que el clima se vuelve más frío y el COVID-19 continúa circulando, todavía hay tiempo para vacunarse contra la gripe. Tanto el COVID-19 como la gripe por sí solos pueden causar enfermedades graves e incluso la muerte, y juntos pueden ser mucho más letales y con mayor riesgo de causar efectos negativos secundarios. Para recibir una vacuna contra la gripe, puede llamar al 826-7238. El 1 de noviembre entró en vigor una nueva definición de casos positivos sospechosos. Un caso sospechoso es un caso que tiene un resultado positivo de una prueba de anticuerpos y nunca ha sido un caso confirmado o probable. Un caso sospechoso también es un antígeno positivo post-mortem. Así que ahora tenemos 3 definiciones de casos: caso confirmado, probable y sospechoso. El Departamento de Salud ha estado experimentando el aumento de llamadas pidiendo una prueba para detectar el virus. Las personas que llaman dicen que estuvieron expuestas en las fiestas de Halloween, donde descubrieron que estaban los casos positivos de COVID y ahora tienen síntomas. También nuestros empleados que rastrean casos están viendo a más personas que han viajado recientemente y están regresando al condado de Nueces. Entre esos casos, una familia de 6 que viajó a la ciudad de El Paso para una boda. Los 6 resultaron positivos con COVID. Las escuelas también están viendo un aumento de casos debido a la instrucción en persona, así como los eventos deportivos. Esta situación es peor ahora que en julio. No tenemos vacuna ni tenemos medicamentos que puedan tratar este virus. Una buena noticia es que la vacuna podría estar disponible a principios de enero. Para evitar contraer el virus, planee quedarse en casa el mayor tiempo posible y evitar estar en contacto con otras personas. Recuerde el distanciamiento social, lavarse las manos seguido y la utilización de cubrebocas.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID-19 Task Force for the Coastal Bend area. The purpose of the task force is to address your concerns and questions about COVID-19 and the interventions that are taking place to stop the spread of COVID-19 and to help to enable evidence-based decision-making on both the parts of our leaders and ourselves. There's been a lot of interventions that have occurred right now. You're encouraged to stay at home if you can. Wear face coverings and do your social distancing. Self-isolate when you're symptomatic or exposed to other people that tested positive for COVID-19. Then contact your doctor, get tested, and go from there. There's school restrictions in place, but as Public Health Director Rodriguez said, that's been getting rolled back. And we're transitioning to a more open phase, which usually comes along with more transmission of COVID-19 and more illness. Right now in the Coastal Bend area, there's been 24,546 total confirmed cases of COVID-19. with 23,107 recoveries. The active cases is 709 right now. That's more than 50% higher than last week for a 7-day change, and the cases are increasing right now. If you look at our percent positive tests overall, it's somewhere between 10 and 15%. I won't belabor the point too much, but it's been moving upwards, and this is a very high percentage of positive tests to be getting, so we'd like to see that change and become lower. In the Coastal Bend area, we look at the 12 different counties. That's what's represented on this graph, the new cases per day. What you can see is that between Nueces and Jim Wells, they're driving the increase in COVID-19 in the Coastal Bend area, with a healthy contribution from several of the other counties, which were lower and since about mid-October have kicked up and are getting steady levels of new cases of COVID-19. So we transitioned to Open Texas Phase 3 again. Now the cases are coming back again. If we look at the whole state, we can see that we're actually doing pretty good right now compared to other parts of Texas. If you remember the huge outbreak that we had here in the summer in South Texas, it doesn't look so huge anymore compared to El Paso and Lubbock and Northwest Texas, Amarillo. These places have more COVID-19 cases per day, per capita, than we had at the peak of the summer outbreak. So it is possible for another outbreak to occur. If you look back to the summer, they also experienced an outbreak. It just wasn't quite as big as ours. Yesterday or the day before, there were 3,000 new cases of COVID-19 in El Paso County. There's only 33% more people in El Paso County than here. So that would be like 2,200 new cases here if we go down the path of El Paso. And that's what we want to try to avoid here. So this is where we get into where are we headed. So what you see here on this graph is a new graph I've never shown before. The points are data points. They're new cases per day for the Coastal Bend. And the red line is our model that we use to estimate the transmission rate. And right now, based upon this increase that you're seeing through this area here, from September through now, we estimate that the transmission rate is 1.9. This is a pretty solid estimate. We don't have a lot of uncertainty in this estimate at this point. It could be a little higher, it could be a little lower, but 1.9 is a pretty good fit. The vertical lines on the graph, they represent when different interventions or rolling back of interventions took place. Green means rolling back, so we transitioned recently to Open Texas Phase 3, where occupancies were raised to 75% in businesses, and then bars opened to 50% capacity. Right around that time, our transmission rate changed from 0.9 to about 1.9, according to our model. Now, here's the big question: what's going to happen moving forward? So with a transmission rate of 1.9, while it doesn't seem like it right now, exponential growth is this thing that really sneaks up on you. If COVID-19 is increasing, it's exponentially growing. The only question is how fast. When that transmission rate is 1.9, which means for every one person who gets COVID-19, they're transmitting it to about 2 additional people. That exponential growth can really take over fast, just like in El Paso. And you can see here that what we project right now is that by about December 7th, we'll be triggering the statewide rule where when 15% of patients in the hospital are positive for COVID-19 for 7 days in a row, then Open Texas Phase 3 can be rolled back to Open Texas Phase 1.5 sort of scenario like we were in for about 3 months over the summer. So we don't really want that to happen. If we go farther into the future, we'll peak out in terms of number of new cases somewhere around December 17th, assuming that the change in transmission rate with this change in policy results in about the same change in transmission rate as back over in the summer. Will start to decline, and then somewhere in early 2021, we'll transition back to Open Texas Phase 3 again. Again, that would be when the hospitals had less than 15% of their patients positive for 7 days in a row. We transition back. Now, we've never gone this far in the future before with this much precision, but at this point, it's not our first rodeo. We've been here before. We've been through a big outbreak in the summer. We know how the coastal bend responds in terms of transmission rate. And so we're just applying those principles now, combined with the state's policies that allow us to predict when will policies change and how will they change. We feel that if nothing else changes in terms of policies, that this is a very realistic scenario. And it's not hypothetical. This is our prediction right now. So with that, we can go over to the number of people in the hospital. Again, it looks like we're going to have potentially more people in the hospital than we did over the summer if this outbreak is allowed to move forward. So it doesn't look like it yet. There's been a small uptick, but we've been pretty level with the hospitals and with the hospitalizations due to COVID. But we're predicting it's about to shoot up in the next couple weeks. So we'll see if that comes to pass. I hope it doesn't. But if it does, we predict that the census in patients with COVID are going to peak around December 21st. And while we're talking about hospitalizations, just right now with the ICU, we're at 23 positive patients in the ICU, and then there's 158 patients overall. The number of patients in the ICU is about normal, but having 23 COVID positive people in the ICU is not normal, so that's 23 people that aren't getting the care that they normally would if they were sick in the coastal bend. This has remained approximately level for the past several weeks, but again, we're predicting this is going to start to increase. And then going to fatalities, this is our model again, same sort of scenario. The points are the number of new fatalities per day. The line is the model. We project that there's going to be more fatalities in this next outbreak if it should progress the way is predicted right now based upon that transmission rate of 1.9. They'll peak around December 27th before they fall back down. And so far in the coastal bend, we've had 730 fatalities. If you think about it, that's for every 1,000 people in the coastal bend, one of them has died now from COVID-19. For every 1,000 people that have gotten a PCR test for COVID-19, 30 of them or more have died. So this is a large number of people that are dying, not only in the coastal bend, but across the country where it's well over a couple 100,000 at this point. Fatalities. In terms of our trends, we are trending downwards or level. Jim Wells fatalities have started to decrease. We've been watching that for the last few weeks, and hopefully that trend stays the same. So in summary, the transmission rate, we estimate it to be 1.9. This is much higher than a flu sort of transmission rate could ever get. So this is a real serious thing, even if it's not as big as the transmission rate that we estimated over the summer. So we're projecting that there's going to be a fall outbreak if nothing changes here. New cases are increasing locally, and they're predicted to rise more. Hospitalizations are level. They're predicted to rise in the very near future. Fatalities are leveling off. They're predicted to rise a little bit following the hospitalizations. And overall, as occupancies rise, so we transition to Open Texas Phase 3, schools are opening up more face-to-face. The weather's cooling down, so people are spending more time inside. All these things are good for COVID and bad for us. So what do we have in our arsenal to combat or to protect ourselves from COVID and to combat COVID? We have face coverings. If you're out in public, wear a face covering. If you go inside with family, wear a face covering. These are the ways that you stop transmission. Social distancing, it works. It's not perfect. 6 feet is not some sort of magical number, especially because we know that COVID-19 is aerosolized and can easily travel more than 6 feet indoors. So what do? Minimize your time indoors in public. If you're going out shopping, go and spend all the money that you can as quickly as you can at the business and then get out. In El Paso, where they had 3,000 new cases in one day with only a population of 800,000, just slightly more than in the coastal bend, 50% of the people that were getting COVID due to contact tracers determined they got it at big box stores, they got it at grocery stores. So being inside with other people, large numbers of people, is not good for you, it's good for COVID. Lastly, these tools, they're super important now. We can't avoid at least some level of outbreak here. But if we change right now the trajectory that we're on and our behaviors, then it's possible to make it be much smaller than is projected right now if nothing changes with the transmission rate. So with that, I'd like to thank you for tuning in, and we'll go to a translation.
Le queremos recordar que las intervenciones no farmacéuticas continúan vigentes para así evitar el aumento de contagios. El reporte de la universidad cubre 12 condados del área de la costa. Se reporta en total al momento 24.546 casos confirmados y 23.107 recuperaciones. El condado de Jim Wells y el condado de Nueces son los condados con mayor número de casos confirmados. El condado del Paso es un condado con el mayor número de casos en el estado. Tan solo en un día se reportaron más de 3.000 casos positivos. En nuestra área, el radio de transmisión se pronostica llegar a 1.9, o sea que una persona infectada puede transmitir el virus a 2 personas adicionales. Con este radio de transmisión, el aumento puede ser muy rápido y descontrolado. El pico de casos se estima pudiera llegar para el 17 de diciembre si continuamos con ese radio de transmisión de 1.9. En nuestra área se reportan 23 personas en la unidad de cuidados intensivos con el COVID. En cuanto a fallecimientos, el pronóstico aumenta y el pico pudiera ser para el 17 de diciembre. A la fecha, los fallecimientos se reportan en 730, incluido el condado de Nueces. Es importante que continúen tomando sus medidas de salubridad, como distanciamiento social, uso de cubrebocas e higiene, sobre todo lavando sus manos con frecuencia.
All right, we're going to go to some questions from Facebook Live, and I know there's at least one for the Public Health Director, so I'd like to invite her down here. We can take one in the meantime.
Okay. So some of the questions coming from Facebook is, how can we minimize the predicted surge?
The best way to minimize the predicted surge is to analyze, think about what you've been doing, what kind of risky behaviors have you been engaging in, and try to ask yourself, how can I avoid those situations? So if you're not wearing your mask in certain situations, maybe try to wear the mask again. If you're outside, wear a mask. If you're outside your home. You can easily get COVID from your family, so there's nobody that you're safe from. This is not a type of thing where, well, I'm with my family, so everything's going to be okay. So, I mean, all these things we've been talking about, social distancing, wearing your mask, don't throw a huge party at Thanksgiving this year. I mean, I know that we don't like to have our lives interrupted, but what really interrupts your life is if you get COVID-19 and you have really bad and severe symptoms, and then even worse, if you pass it on to other people. So this is what we're trying to avoid here. Just do everything that people are asking you to do. If we don't change collectively in the coastal bend, then the graphs that I showed, they may not be exactly what's going to happen, but something like that is going to happen.
So along those same lines, and with the predicted increase and the holidays coming up, what are your thoughts on the college students going home at Thanksgiving and hanging out together?
Well, students, a lot of college students aren't going to face-to-face classes. Those that are, when they go home, they should be mindful of their parents. The parents are more susceptible to COVID-19 than themselves. It's not really the time to go and spend a lot of time with, elderly or, people who are really, not doing well in terms of their health. You need to find other ways around that. But when students come home, it's not a good idea to go out, for that party, to get together, get the gang back together. It's not the year to have that happen. I know when you're younger, you're a lot less likely to die or have severe symptoms, but you need to think about the rest of your families and the rest of society there. And you don't want to catalyze that sort of event.
And Annette, this question's probably more for you. Will the suspected cases be added to the city-county website? And right now it is still just confirmed and probables?
Yes, so right now we're reporting them out as confirmed and probable. So on the dashboard, you're only seeing them reported those two ways. But we just started to break them out as of November 1st. So we will see a change to the dashboard to add the confirmed, the probables, and the suspect cases.
Okay. And this is probably for both of y'all. So as we are going into the predicted surge, will more updates be increased during this time, these updates here?
If more updates are needed, if we have additional information, if we start seeing that, you know, the numbers are going out of control, basically, yes, we will increase the number of times that we do the press briefing, just to make sure that we're able to communicate effectively and timely to the community.
And are people who meet clinically without confirmation testing still classified as probable?
If they're just clinical, but there is no test?
Without the confirmation testing.
So if they have a PCR test, then it's it's a confirmed, you know, case. If they have an antigen test, then it is a probable. So if they have an antibody test, then it's a suspect. If they have an antigen test post-mortem, then it's a suspect also. If they don't have any test and the clinician diagnoses it, it's a probable.
All right. And is there any plan for the Coastal Bend right now that you know of for the vaccine? Any plans for that?
You know, we are starting to hear more from the Department of State Health Services, and they're in close contact with CDC. It looks like we might be getting some vaccine, you know, by January. And so we know that when we do receive vaccine, it's going to come in small quantities initially. They have 2 that are in the phase 3. It's Pfizer and Moderna. Pfizer, CDC has an agreement with them to purchase 100 million doses, I believe, and Moderna has to purchase 20 million doses. So there's a lot of intricacies to storage and, you know, distribution. And so all of those things, we're kind of looking at them right now to see how do we receive it. The Pfizer is sub-cold temperatures, so it's at negative 94 degrees Fahrenheit. And so there's a lot of things that goes into actually receiving it before we can distribute it to the public. But no, we haven't received any yet, and when we do, we will let the public know.
Thank you. And that's all we have from Facebook.
Are there any other questions? No? So thank you all for being here with us this evening. We appreciate it, and we will be back next Tuesday at 5 o'clock for our press briefing on the COVID cases. Thank you.